Hello everybody, my name's Aaron Gibson and welcome to my 2017 academic case study video. I chose a ethics rounds article with the name, or should I say title, of A Young Adults with Jehovah's Witness with Severe Anemia. And the article I chose, it talks about a young 18-year-old woman who has a sickle cell disease that has life-threatening anemia. Now, the problem is because of her religion, which is being a Jehovah's Witness, there's certain things that they can't do when it comes to helping themselves medically because it go against what their beliefs are in their religion. So a lot of people think that Jehovah's Witnesses don't believe in medicine or medical treatment. But it actually, Jehovah's Witnesses always seek out the best possible medical care for themselves and their family. When they have health problems, they try and go to different doctors who have the right skills pertaining to what they need help with, whether that be a disease, an infection, or an abnormality. Sorry. But they also try and go to doctors who provide medical and surgical care without blood. They appreciate, and by they I mean Jehovah's Witnesses, appreciate the advancements that have been made in the medical field over the years. In fact, bloodless treatments were developed to help witnesses, Jehovah's Witnesses, who are now being used to benefit all in the community. One funny fact is, in many countries, any patient can now choose to avoid blood transfusion, such as bloodborne diseases, immune system reactions, and even human errors. Another problem that many people have is they think that Jehovah's Witnesses believe that Jehovah's Witnesses think that faith will heal them. That's not true. They will still go to the doctors. They're not going to go and just pray and be healed like that. That's not what they're going to do. Another reason people think that Jehovah's Witnesses avoid blood transfusions is because it costs a lot of money. No. It's not that the blood transfusion costs a lot of money, but medical treatments that avoid blood transfusions are cost effective. And that's pretty much why. A lot of people get to the conclusion after reading the article, why don't Jehovah's Witnesses accept blood transfusion? This is a religious issue rather than a medical one. Both Old and the New Testament clearly command us to abstain from blood. Also, God views blood as representing life. So Jehovah's Witnesses avoid taking blood not only in obedience to God, but also out of respect for Him as the giver of life. At one time, the medical community generally viewed strategies for avoiding transfusions, so-called bloodless medicine, as extreme, even suicidal, but this has changed over the years. For example, in 2004, an article published in a medical educational journal stated that many of the techniques developed for use in Jehovah's Witnesses patients over the years to come. An article in the journal Heart, Lung, and Circulation said in 2010 that bloodless surgery should not be limited to Jehovah's Witnesses, but should form an integral part of everyday surgical practice.